familiar with, we go live on multiple different platforms. So we're just going to wait a few seconds or a minute till we're synced up everywhere, and then we'll officially start. So, and as always, we encourage questions in the chat. I'll be monitoring that during episode, and we can bring up anything that you'd like to bring to this conversation from the chat feature. So just a few more minutes, and we should be synced up on all our platforms. All right, so we're synced up, so we'll get started here in 3 seconds. So welcome back to Coach Connect. Here's where we explore the stories and strategies and insights from trailblazers who are transforming the world of coaching and well-being. What drives their success? What fuels their passions for helping others? We're here to uncover those secrets and share them with you. This show is brought to you by Vibely.io, the all-in-one coaching platform designed to empower coaches with tools, resources, and support they need to thrive and help their clients achieve meaningful, long-lasting growth. I'm Dr. Diego Salinas, your guide on this journey. As a neuroscientist, physician, health coach, and co-founder of Vibely, I'm committed to celebrating the incredible work of coaches everywhere and helping them unlock their full potential. So together, let's dive in deep into what makes coaching a powerful force of change. Honored to have today's guest, Dr. Karen Lawson, who's the founder and CEO of IHWC Productions, a consulting company that works with programs and individuals to advance and expand training in integrative health coaching and holistic healthcare. And she provides integrative health coaching to individuals directly. She has served as a founder and director of the Integrative Health Coaching at the University of Minnesota from 2005 to 2022. She's a physician, board certified in integrative and holistic medicine, and a founding board member of the National Board of Health and Wellness Coaches. Karen's a lifelong dancer, has had a yoga practice for 30 years, and loves to work with individuals who are ready to take control of their own health beliefs and behaviors, and to change and be in charge of their healthcare experience. Karen, welcome to the podcast. So honored to have you on today.
Thank you, Diego. It's nice to be here.
Yeah, so I've had a pleasure of knowing Karen now since maybe last year or so. We met at a conference and been connecting, but we always start off with people's stories, kind of what led them into this field of helping. So Karen, I know you have a long, long background, but really curious how you got into integrative medicine, and from there, how you were one of the founding members of the National Board of Health and Wellness Coaches.
Yeah, it sounds like we should be doing this either over a cup of coffee or a glass of wine, and I'm not sure which. I guess it's too little early in the day, so maybe the coffee. But
Maybe Irish
um,
coffee, right?
yeah, exactly. Well, I am a physician. I did start out that way. Actually, I was a research biochemist before I went to medical school, and like you, was in the neurosciences. Did research neuropharmacology before I went to medical school. Um, got through medical school finding myself a little disillusioned that everything was very fragmented and it felt like we were kind of putting parts of people into silos, and it's not really the way I looked at the world. So as I went into my residency, I had always thought I would go into a residency in a specialty like neurology or something like that, and read and do research, which is my background. And instead, I really found myself wanting to find some way to approach the whole person through a whole system, and was struggling to figure out how to do that in conventional Western medicine. So I went into family medicine because I thought that was the only place I could see where they at least acknowledged whole people who had families and communities, right? And they were all in it. It was they were whole people. But even there, I found that as family medicine was competing to become recognized as an academic specialty, it was going more and more the way of also kind of treating pieces of people, which troubled me. But I finished my residency. I did family medicine for a couple of years, as well as worked in the emergency room for 10 years. And during that time, I thought there must be better ways out there to do this than the way that we're doing this in conventional medicine. I started my exploration really with mind body training, because I thought that's the part that's getting left out of our big picture. So I was one of the first professionals that did training in mindfulness-based stress reduction with John and Saki back in the early 90s. And I studied Vipassana meditation. I did transcendental meditation. I was a dancer, so I was already doing that, and I started yoga studies. As the more I got into practicing, the more frustrated that I was in watching the experience that patients were having, where they kind of came and they needed something expert told to them or done to them, right? But then they left and nothing often really changed, and people would come back over and over and over again, and we'd have the same conversation over and over again. And
Mm,
I got to the point where I left family medicine because I felt hypocritical that I wasn't being given the time or the kind of the container for really doing what I felt should be being done with people doing healing work. So I moved into the emergency room full time where I had more time to be able to study other things.
mhm.
And in the emergency room, at least I felt like I was being honest with people that you're here for an acute problem. We're going to fix that now. We don't have time here to address your whole life like you should be doing with your primary care doc, right? But
Mhm.
actually, the nurses in the emergency room used to get annoyed with me because my discharge instructions were always lengthier and stranger than they had programmed on the computer because I was giving people books and videos to watch and conferences to go to and supplements to take
The
and
holistic care, like
a
why not?
holistic care, and yes, and giving them the names for people and types of practitioners that the nurses had never heard about. So it became very clear, by the time I had studied a fair amount, and I moved my studies from mind body into then I studied classical homeopathy for 2 years. And in 1997, I made the leap entirely from conventional healthcare into doing an integrative and holistic practice. I was involved with a couple of startups, one in California and one in Michigan. And I felt like things were moving in the right direction, that we were giving people a better model. But I was really fascinated by the fact that I had kind of made the assumption then that pattern of people coming in and seeing an expert having something done to them or told what to do would be different in an integrative approach. And what I found when I was a medical director of an integrative care center at a large hospital system in in Michigan, and I had about 25 providers that provided about 17 or 18 different types of approaches. So we had chiropractors and acupuncturists and nutritionists and physical therapists and, spiritual people and you name it. We had everybody. But I watched this pattern of people coming in and still, now they had longer with their providers than they usually did with their primary care doc, right? And they maybe seemed a little more engaged and they came more often. But for example, some of the chiropractor patients had been coming for 10 years and were still dealing with the same problem and coming back every 3 weeks for their treatment. And and people weren't making changes in their own life that was allowing themselves to progress toward a greater level of health.
Mm,
And I thought, okay, okay, if that happens in conventional medicine, and now I'm watching this happen in integrative medicine, something's got to
mm,
change, right?
yeah.
So I was really curious, and I had a good friend and a mentor who's still a mentor. She's 83 and still runs 3 businesses. So Linda Bark,
Yeah, she's
um,
amazing.
amazing. So I had been at an integrative training where she was one of the teachers back some years earlier. And Linda, in addition to being a PhD and a nurse, was also a coach. At that point in time in the 90s, coaching was really executive coaching, life coaching, leadership coaching. There really wasn't any health and wellness coaching in existence. If people were doing it, they weren't talking about it. And
Mhm.
so I called Linda and I said, do you think there's some way that we could apply these coaching principles and ideas to help people with behavior change in the healthcare world? And she
Mm.
said, most definitely. And I'm like, how do we do that? And she's like, well, you have to learn coaching first. And so she, bless her heart, as a single woman, agreed to come and move to Michigan and lived in my home for 3 months and trained my holistic nurse practitioner and myself as coaches.
I didn't know
And
that part of the story.
yes, and so and has continued to mentor us over the years
Yeah.
as she's gone on to become quite a teacher and leader herself. So it was interesting though. Then what happened was Linda went back to San Francisco, and we launched coaching services through myself and my nurse practitioner, and none of the care providers would refer their patients, and I was really really puzzled. And I'm like, okay, this is confusing. One, I
Mhm.
discovered the first time, and I know you know this, people don't understand what coaching is, right? They have all kinds of misconceptions about it. The care providers, many of them in the integrative center, were fee for service practitioners because their services weren't covered by insurance, and they perceived the coach as being somebody competing with them. And they
Mm.
also thought that I can't tell you how many chiropractors and acupuncturists I had tell me, but I am a coach. I coach my patients. And their idea of coaching was educating, telling them what to do. And I'm like, okay, we need to shift perception here. So what we did was with the agreement of my nurse practitioner and my finance person, we invited all of the practitioners to pick their hardest couple of clients or patients, their most um, challenging ones that hadn't made any progress, right?
Hmm.
To the nurse coach practitioner for free for 3 months. So they took it as
Lower the barriers,
no
try it
barriers.
out. Yeah.
We threw down the gauntlet. And
Uh-huh.
this was before the days of electronic medical records. So some of them had charts that were 12 inches thick. So they picked their top chronic pain patients, chronic illness patients, people with pain med addictions, all kinds of stuff. And they referred them down the hall to Nurse Coach Mary, with me and some oversight. And it was fascinating. Within 4 to 6 weeks, people who had not made a change in years or decades were making changes. And their providers, who sometimes saw them biweekly or once a month, were noticing and going, wow, this is different. Started asking questions. Nurse Coach Mary, agreed to actually provide a coaching session to some of the providers that were willing so that they could experience it, right? You
Yeah.
understand it best when you experience it, so they
Yeah.
could really understand. And the providers are like, oh, that's not what I do. And the biggest aha was the providers go, oh, that makes my job easier, right? Because I can give them my expertise. I can do what I do. I can tell them which supplements they could take, what exercise plan they should be on, what diet they should be using, what self manipulation they should be doing for their body work. And then I can send them down the hall to Nurse Coach Mary, will help them figure out how to do it, right? So within 6 months, Nurse Coach Mary was the busiest practitioner on my team.
Because it's the biggest bottleneck is in behavior change.
It was an amazing experience. And
Wow.
then, of course, what happened, as what happens in healthcare systems often, we had a CEO turnover. My CEO, who was loving and supportive, went to California to do a turnaround. And the CEO that they hired didn't believe in or support integrative healthcare. And started kind of dissembling things, even though we were above our predictions for financial success on the launch of it. And I just couldn't stay there and watch it. It was
Yeah.
too painful. So I left. I ended up coming to the University of Minnesota on an NIH educational grant, the first in the country. We were the first of 5 places in the country that got educational grants from NIH. And my task was to train physicians, mostly medical students, some residents, in integrative medicine. So that's what I was on the grant for. The director of the center, who was always a future forward thinking person, was intrigued about my coaching experience and said, do you really, kept saying, do you really think that health coaching can change how we do medicine? And I said, yeah, I think it may be the only thing that can change how we do medicine. So she said, well, that only happens if we have health coaches to hire, right? And at that point in time, Well Coaches had launched in about 2003. This was 2004. There were no academic programs. And she said, we need, if they're going to be a recognized player in the healthcare field, we need to have academic training programs. So develop one. So I was blessed to obtain a 1 year long private family foundation grant that helped pay me and 5 other people. And I put together an interdisciplinary, interprofessional team, all of which had many more years of coaching experience than I had. And we developed a 2 year curriculum for healthcare providers in an academic setting. And we launched the first graduate certificate in integrative health coaching at University of Minnesota in the country in 2005. And then went on. Then I kept hearing from people. People called from all over the country. Interesting.
Wow.
I don't even know sometimes how people found out about it, but I got calls from lawyers and engineers and personal trainers and all kinds of people calling saying, I'm really interested in this health coaching thing.
Mm.
But because of the rules of our program, you had to have your academic degree in a healthcare related field. So
Okay.
people who didn't have that couldn't enter our program. So that really led me to recognize how many people that had a passion for health and well-being were out there that didn't go into medicine or healthcare because they didn't like the disease focus, they didn't like the pharmacology focus. And so they had done other things, but they were still passionate about health and well-being.
Mm.
So because of that, I felt driven to develop a master's program in health coaching, which took about 2 years to get approved through the Board of Regents, which is an experience I would never repeat. Um, my final application to the Board of Regents was 478 pages. They should have given me a PhD for doing the program application. But anyway,
Oh
we
my
launched a
goodness.
master's program. So now people from any kind of background that had a bachelor's degree and had certain prerequisites could come and be trained as a health coach, and it was a 2.5 year program. And so, it's kind of continued from there. So I'm going to take a big breath and see what you'd like to say.
Oh, so much there. I think to everyone listening, to saying we see so far till we stand on the shoulders of giants,
Yeah.
right? To recognize how much work had to do to be a groundbreaker. And something you said earlier about the CEO not believing in this, right? I think that's a problem in healthcare. I would say that healthcare, the problem why it's ruined is it's not run by people who know the liver is.
Right. Right.
If you don't, you
Right.
can't with thrombocytopenia, you can't say I'm spending time with my patients. And this idea that I don't, this hubris that, well,
Yes.
I know something, why should some people who want boots on the ground?
Yeah.
I
Yeah.
think is, I think that approach, I think is why a lot of people are frustrated with healthcare. And we have a mix of coaches and clients in the audience here. I think a lot of people see the provider as the one who's in charge of healthcare. They don't recognize that we are also victims in a sense of the system.
Yeah.
Not to
And two
victimize it,
parts. Two
there's two
parts of the
parts.
system. So we have the administrator director pieces, right, who are running hospitals or running clinics and stuff. And we like to think that some of them have been educated in such a way that they have a better understanding. But then we also have the administrators of third party payers, and the people who are controlling the purse strings.
Yeah.
So on both parts, you often have people who are not providers. I mean, I can personally say I was turned down years ago, like this was back in the 80s, for life insurance for a genetic abnormality I have that has no impact on my health care, has no impact on my life expectancy. Actually, it probably increases my life expectancy.
Mm.
But it's a very, very rare condition. And it actually just meant I couldn't have children. And I was turned down for life insurance because of that. And when I contacted them, their medical director had turned me down. And there's a name for the syndrome, and it's very, I never learned it in medical school. And when I called, the medical director said, well, it's because you have this syndrome, and that increases your risk to the health insurance. And I'm like, tell me what that syndrome is. He had no idea. He couldn't even define it. I'm like, now he could Google it, but he didn't have
Yeah.
Google then. And he
Yeah.
was embarrassed to admit that he didn't know what it was. And when I informed it what it was, then he was really embarrassed. And he was a physician working for insurance companies.
Mm.
So, you have to push back sometimes. You have to challenge, you have to ask questions. And my experience is that in the last 30 years, things have gotten worse, not better.
Yeah.
And I think insurance personnel are often trained say no first because they know if people won't push back, that they
Mhm.
can not authorize a lot of charges that they should be authorizing.
Yeah, I mean, I think this underlying theme is advocacy, right? And then how I think a lot of physicians or healthcare workers start off as trying to be patient advocates and feel frustrated by the amount of advocacy they can do within the system. I'm like, why is my
Exactly.
voice not being listened to here? And I think coaching, something you mentioned, this really does integrate. That's something about the integration, right? You're talking
Yeah.
about integrative medicine. It sounds like when you first started integrative healthcare, you're like, all right, it's still kind of a treadmill. It's a bigger treadmill, but people are still kind of in the same place, and you want to see people advance forward. And coaching is, I would say, it's a lot of things, but when I'm teaching it, I say there's two things we're trying to help our clients achieve. It's insight and forward momentum.
Yeah.
That's kind of what we're trying to facilitate for someone, and it really is effective at that. And then I think until you, a few points you mentioned, I think there's still a lot of confusion what coaching is. And I said a
Yes.
story many times that I didn't know what it was until about an hour into the program. I was like, oh, wait a second, this is not teaching.
Yeah.
That word neurolinguistically has a lot of already predefined meanings, as you mentioned, right? And
Yeah.
then even this idea of that, hey, this is competing with you versus this is a person who's actually, when I found coaching, kind of like you, Karen, I wanted to first do like either nephrology, neurology, or endocrinology. I love the
Right.
nitty gritty,
Yeah.
but no one was putting these systems together. And this reminds me of last week I was at a conference and I said, we study things in systems because it's easier for our brain to kind of share information that way. But the
Right.
body doesn't think cardiovascular and GI. The body is one sack of skin with all happening in there.
Yes.
And people beyond that are also systems. And if we try to look at any part of the system in isolation, you're never going to get a complete picture.
Right.
And coaching was kind of like doing, I went, okay, let me do general because it's more integrative. It's kind of puts everything together. Actually, coaching took integration of what's in the hospital and what's out of the hospital for me.
Yeah.
That to me was the real kind of unifier. It
Yes.
made a bunch of other things too. So I think for healthcare workers to realize this is the profession we were missing. So when someone rolls their ankle, we think send a PT. Someone
Right.
has an accident, OT, right? I want to think, oh, it's a person. Give them a health coach.
Right, exactly. And I really think, I mean, it's like years ago when we were first, really moving the holistic medicine movement forward. The hope always was that someday it wouldn't be called that because it would just be good medicine. Someday all medicine would be that. There wouldn't be a need for a subspecialty of holistic medicine because all medicine, all good medicine would be whole person health, would be that. And I really think that's true from a coaching standpoint. I really think that every clinic should have health and wellness coaches. Every individual that has a healthcare team should have a health coach. And I really think, and I know that you and I have both done work in this area, I really think that all healthcare providers should be trained in some level of behavior change skills, motivational interviewing, some basic things that are tools that we use in coaching that would be supportive so that the coaching works together with the practice of medicine, which would be a
Yeah.
really great thing. And we are seeing movement in that direction. I mean, I know even just I continued to teach in the medical school until 3 years ago. And we did make some progress. We had, motivational interviewing training was brought into the first year. I taught communication, advanced communication practices to third and fourth year students. We couldn't call it coaching because then they thought it was something that they didn't need to do. But we could
Because it's
call
like
them,
below me. I'm not a,
that's right. So we could call them communication or connection, relationship practices, things like that. But it was coaching.
yeah,
Yeah.
yeah.
But it also helped them understand how somebody that coaches professionally full time has a different way of interacting with that person. It's a different power dynamic,
Yeah.
and I think that's the biggest challenge I've seen over the years as I've trained a number of healthcare providers in the last 20 years to, if they want to truly actually be a coach and not just use some coaching tools in their practice, there's a lot of letting go of that role and that identity but I have the experts, but I have the power, I have the control, I have the information. And leveling that power dynamic, the longer somebody's been in medicine, one of the challenges I found, those, the nurses that have been practicing for 35 years, they really want to fix people. And it's
Mm-hmm.
really hard to get out of that fixing mindset. And the social workers, they have a way of rescuing, right? And the physicians have a way of telling you what to do. So they all healthcare providers have their thing.
Yeah.
And transitioning to coaching is a real shift in a mindset and is a really coming to a place of honoring, of non-judgment, of really believing in a person, which is totally not what I was trained to do as a doctor, right?
Yeah.
It's a real shift, and I think it's a shift that it should happen all throughout healthcare, but I think coaches are going to have to do it first.
Yeah, it's a lot of really great points there, Karen. That like, as you and I both teachers in this, I tell people it's a mindset we're trying to teach you. It's not a skill set,
Yeah,
right? So you can use coaching skill set in certain things, but some of those skill sets are used in sales. They're not. That's not
right,
coaching, right? It's not
right.
MI, right? So it's really that mindset shift. And to your point, we are, I think, as coaches in training, should have compassion on ourselves because we have to change the way we've been thinking for decades, possibly.
Right.
It's not going to change overnight. And I remember someone pulled me aside after when I was still training. It was in person, and they kind of held me back. They said, Diego, stop trying to solve their problem. It's not your job anymore.
Yeah, yeah,
And that always stuck with me. And it was this. There's a lot of duality here, where like there's a freedom there
right.
in a sense, but also like you have to. We all go into to help someone, but you have to be in the moment like mindfulness. You're not attached to the outcome, and that's how it works.
Yeah, yeah,
You have to let someone have their own process, and it's so different than what we're trained in, and even behaviorally enforced ourselves. We got points for answering our question on the test, for giving
right.
advice. On our notes,
Yeah,
patient was given information for 15 minutes and da 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 da.
yeah,
So there's a lot of things kind of we have to unlearn or do, and the fact that how to change the medical perception of the value here, but even in the training of it. Because on the exams, the easiest questions are behavior change, right?
right,
Miss Johnson comes in, 30 pounds overweight, cholesterol's a little high. What's the first step? B, recommend lifestyle changes and do it,
right,
right? First of all, most people don't even do that first one. They just kind of give them pills right away, to be honest
right.
with you.
Because they don't have time or interest, or actually, what I started to witness with colleagues, which made me so sad, was they just didn't have any hope.
Yeah.
So they really
Yeah.
didn't believe that this was going to be worth their time and energy because no one was going to actually really change anyway. So they didn't
Mm,
believe in the capacity of the person to change, and they didn't believe in the commitment of the person to change. They didn't stop to think, does the person really have the support, the resources, the guidance, the mechanism to make the change? They just
yeah.
had seen over and over and over that people didn't. So why should I waste my time? I mean, I had physician colleagues in their 40s and 50s saying, I don't even bother telling people to stop smoking anymore. And that just made my heart hurt. It was
Yeah.
like, no, you still have to educate people as to their risk. And you have to believe that people can and want to change, but they need support and a process via which to do that.
Yeah. I think from education, you're right. They're seeing this. So kind of we have our own brain that makes calculations and assumptions and numbers. We're seeing that, but also we're not trained with those tools. We're trained with tools of telling someone the bad part of their condition,
Right.
right? And like I said on stage last week, I go, no one's ever smoked a cigarette and gone, and for what? Cancer? You have no, I didn't know
I
this,
never knew it. Right. You mean I
right?
shouldn't eat 2 Big Macs a day? You mean that's,
Right?
wow.
Yet we don't know what actually, and to the point about teaching this, I remember when I took the coach training program, I had this flashback. I was like, wait, this reminds us one lecture I had during second year about something called MI. It was a PowerPoint. I remember I have a little visual memory, and I was like, but again, you can't learn that through a slide either. So I think there's
Right.
the way medical students we rotate through one day with OT, one day with PT, do the nurses.
Right.
I do think that kind of seeing that change and understanding that we can borrow from this as a way to improve our bedside manner. Actually,
Oh,
when I learned coaching skill set, I was like, I've always been passionate about bedside manner communication. I'm like, how do I help someone develop to their improved communication? I didn't know the tool set, and coaching has a lot of great frameworks that you can use to change that mindset and skill set of how to open those dialogues. Now, you
yeah.
may not be coaching in your session because, to your point, there's a power dynamic in medicine that's kind of already there. And coaching really says we are both equal partnerships. I say you're the expert in
Right.
yourself. I should behavior change. We're going to combine these two knowledge bases together.
Yeah.
So even if you are a physician, coach, or healthcare worker, even the setting can make a big difference. When I talk to parents in the ER, yeah, I can tell them all I want, but the machine is going off, you're stressed out, you may not be able to absorb this. So even having a professional team that can create that physical and psychological safety
Yes.
to
Yeah.
be fully vulnerable and open is something that even if we have a skill set, we need someone in the team who just focuses on that part.
Yeah. And even if you think about our language and our vocabulary, it's like it's so insidious. And, I think you've done some NLP, but it informs so much. And if we think about even, the word like patient, which, I would love to get removed from our, which has an assumed passivity with it. Patient generates a visual image of somebody in a blue gown with a crack down the back with their butt exposed, right? That's a patient, right?
Right.
And non-compliant. So what does that mean? A person didn't do what we told them to do. It doesn't explore at all why those changes didn't happen. And it assumes that we knew what was best and we told them what to do and they didn't do it. So therefore they're non-compliant, which now makes my teeth hurt. But that's what we were
Yeah.
trained. And it's still common idioms, in medicine. And
Yeah.
I think we really have to look at what's the messages that we are as professionals that we're giving healthcare consumers, right? What's the information and what's the perspectives that we're giving our healthcare trainees when they come
Mm.
into a system, and we talk about our patients as have you seen that left knee in room 13? I mean, I've that's common language. It's not unusual.
Or even the
Right.
case.
The case, right. Or, have you seen the kidney transplant patient that's, on fourth floor? The depersonalization
Mm,
has been perpetuated by our language and vocabulary, and it's hard to change the dynamic and to make people people again, until we really start looking at all those little insidious ways in which we depersonalize people. And I
yeah,
think that that's one of the things that coaching does, is it helps give people back their own awareness of their own self-efficacy, and
yeah,
their belief in themselves, and it can give people hope, and it can give people, I think, one of the things that coaches can do is to give people the courage and the strength to be able to push back or ask for in their healthcare system what they really need and want, because as you and I both know, big changes come from large volumes of people demanding something else, right? It's a
yeah,
grassroots kind of thing.
yeah.
Um, and that's where the change has got to happen.
Yeah, and so speaking of the, you mentioned the neurolinguistics and language we use,
Yeah.
even when we had our talk before this episode, I didn't think of how the word patient literally has the word patience built into it,
Yes.
right? And like, yeah, they can be patient, they can wait a little more. It's not an emergency kind of thing, right? And something said a little earlier. I've said this phrase that if medicine tells you what to do, coaching is the how and the why.
Right.
That's how I kind of describe it. It's like, okay, yeah, everyone losing weight, sure, it's a goal. How and the why is a million different
Right.
versions and variations. And this really puts that personalization back into it. To me, coaching was the first version of personalized medicine, dare I say, because it was, well, you let me know your goals or plans and your lifestyle, your schedule. And the other thing that came to mind with about language was even, medicine is one of the few professions, medicine in the army, where you give orders.
Right. That's true.
This is the order, right? I give orders in the hospital, right? So of course they're not compliant because it's my order
Yes, that's
in a
really
sense. And so I think this is a nice transition to how uh, you know coaching can be a force to help go from that patient to empowered perspective,
yeah.
right? And I'm gonna leave it open because you've prepared a few different things here too. I'm gonna leave the ball in your court. Where can we start this conversation of? I've supported actually. To be honest with you, the reason I started this was how to help people outside the clinic, and so when they go to do an operation or see their doctor, see provider, they understand what's happening before and afterwards. Because I realized my good friends and family, who are as educated as can be, didn't understand what happened, and I was doing explanations. So I'm like, if they
Right.
don't, you know,
Right.
so how can coaches start being that grassroots effort to make that change and
Yeah.
give people those tools?
Well, I think as coaches, if we speak, from a coaching standpoint, one is to know to know, to have the information to know yourself. What can an individual do to be a informed, empowered healthcare consumer? Because up 20-25% of what we do in coaching is education, and they can help provide information and support to their clients to help them be able to optimize what they do in their healthcare. Some of the things that I like to do with clients, one, I teach a lot of clients nonviolent communication from a speaking standpoint,
Mm,
because it teaches them to use I language in, doctors, I'm going to generalize here, who are time pressured, who may be seeing 5 or 6 people an hour. They're in and out. They have their own agenda, right? If you have a client who is seeing a physician, if they come in very clearly, having identified why they're there, what they want to know, what they need to know, um, their own self-awareness about what's going on. They have notes, they're organized. They're going to get a much better response from the physician than somebody that comes in a very fair but challenging, over emotional state. I'm frustrated. I'm angry. I'm hurt. I'm crying. I'm scared. Whatever I am, you're swallowed up by the emotion. You're not clearly asking what you need. The practitioner gets frustrated. It doesn't go well,
yeah,
right?
yeah, right.
And a coach can work with an individual to help teach them how to organize their thoughts, how to use the I language that you would use as a speaker to very clearly state what your experience is, what your need is, what you're asking for, right? They can practice those conversations.
Mm,
with their clients, and whether that's a conversation that that person, needs to have with their teenage child, or a conversation they need to have with their internist.
right.
People feel more confident when they can practice something.
Role playing it, right?
Role
Exactly.
playing it.
Visualization,
Yep.
yeah.
Let them do it until they feel comfortable. There's still a lot of people from my mom's generation taught me, when you go to the doctor's office, you wait as long as it takes to wait. You wear clean
Patience.
underwear. You don't ask any questions, and you do whatever they tell you to do, and you leave. And that's a really disempowered way to be a client. And maybe that was an okay thing in the 50s. I don't know, but it doesn't work today. And so she would get angry at me when I would come in with her, and when she was in her 80s, to her
Mm,
healthcare provider with a list of questions and very specific concerns about this medication or that medication. And she would get angry with me because I wasn't supposed to question the physician ever.
mm.
I was a physician.
Wow. And you're her daughter. Yeah,
I'm a
yeah.
daughter and a physician, but that mindset, that disempowered mindset, I'm stunned. I still meet people in their 20s who were raised with this idea of like they're just they're consumers, they're uneducated consumers who don't understand medicine. So therefore they shouldn't be asking any questions when they go to their doctors. And they leave unsatisfied. 50% of the time the prescriptions never make it out of the doctor's office or never get filled. And the ones that do get filled, only about a third of them get taken appropriately.
Yeah.
So we have to shift as individuals, we have to shift our perception around how we engage with the healthcare system. I think number one, have a coach.
Hmm.
The second thing that I think is so critical, which because I'm finding now at my age, I spend a lot of time with friends, family members of friends, being kind of a curbside physician consult helper. I'm sure you get those as well. And one of the first things that I tell them is they have to be in charge of their own history. They have to
Yes.
they have to keep records. They have to get copies of important procedures. They have the right to their records and their files. They should have
Yes.
copies of their X-ray reports, their hospital discharge summaries. They should keep a little mini journal or Word document on their computer or whatever that's
Yes.
in this year I had this surgery and this happened. And because in this day and age, up until they're in Medicare, your health insurance may change annually with your employer. That means your provider changes. Your stuff is in different places all over. You don't have continuity of care, unfortunately, way too often, unless you're in a really small town with a single provider.
Yeah.
And so nobody can hold that information but you. And so that's the first place is keep some records, write things down. Don't plan on remembering them, right?
Yeah. Can I
Because you're
add to
going to
that,
make a
Karen?
yeah.
Yeah, I think something you were saying earlier about, being the empowered patient. I think also being the partner patient, right? That I've also seen, while there's that, you mentioned like your mom and people still in their 20s having this reverence, almost like don't ask and just say yes,
Right.
nod, and do what you want afterwards. There's also this kind of like, sometimes because I understand the emotion, you've been already seeing the four doctors for the same issue this week, and you are scared for your health, your kids' health,
Frustrated.
totally understand this. It comes in a combative way. And
Right.
so what I've seen is one kind of really organizational tool you can have is exactly understand your health records. Because even in the same health system,
Yes.
as you and I know, that sometimes the computers from the ER do not connect with the other EMR in the clinic.
Right.
So don't assume that it's the same logo in the buildings that they have all your records. And then there's a
Yes.
lot of frustration on both sides because then you are the clinician trying to put together these background information. Because I say, healthcare is a movie, not a picture. There's a reason I asked about your past information. It puts it into context, right?
Yes.
Like I need to know this to make sense. And the future was part of that movie as well. We have to close follow up and see what happens.
Right.
So if on the provider side, you give them those tools and then what's there. So I'd say, if I could say really high level, your medication list, who prescribed them, how often do you take them, right?
Yep.
Allergies, the reactions, your past surgical history,
Yes.
and past chronic conditions, often think of medications you take, right? Like
Yep.
if you can think of those and kind of some rough timeline, have it somewhere so you can reference, or you can, when they're talking to you, go, here's my medication list, here's
Right.
this, here's this. But I do think having that is something that would empower someone, and then someone can help you understand what's important here. You don't have to know what's important as a patient. I just understand that, but someone can help you organize that. And in the hospital, when I was doing rounds, I would give every patient a Post-it note. I
Yeah.
go, you're going to ask a million questions once we leave the room. Because here's the reality. We come in, we ask you 400
Right.
questions
At 5:30 in the morning
at
sometimes.
5:30 in the morning. So have your list of questions and say, hey,
Yeah.
this is what I really want to know, what I really want to get out of today's meeting, right? So I want to, sorry for
Exactly.
pausing there. I think some kind of really tangible. If you can think about
Yeah.
past medical, significant diagnosis, surgeries you've had, when and who was a provider, give me path reports there, obviously
Yes.
helpful. Who else you're seeing?
Yes.
Specialists, allergies and medication. I think
Include
top five
complementary
like take homes.
include complementary providers in those providers, because if a physician doesn't ask, often a client won't tell them. So they could be, they could be getting most of their health care from a chiropractor or from a traditional Chinese medical provider, and they never even tell their physician that they're on, oh, that person gives me some herbs, but that has nothing to do with my medication, right?
And we know St. John warts can
Yeah.
mess up
So
your
yeah,
MAOI inhibitors, which can cause all these
yeah, we
exactly.
have to know
Yeah.
those things. And I would say on that list of things, I would add laboratory results and imaging findings. Because boy, having records of that MRI that you had 8 years ago would be really helpful when we have this MRI now. And oh, there's a comparison. Wouldn't that be great? And this day and age, you can often even get things on a CD,
Honestly, yeah.
and then you can keep it, so you've got it. So I think that's really important. Yeah, so all of those things and keep them in one place. I think the other, the next step that I would say is my tips to patients is they need to take ownership of the fact that they are the expert in their own life, which means they need to be paying attention. They need to, if they aren't going to remember, they need to write things down. But what are they experiencing? If there's an issue, when does it happen? What makes it better? What makes it worse? Practice their own self-awareness. Keep a little journal if they need to. Score their pain every day, whatever it is that's relevant to what's going on. Because all too often, very human nature, you go in and you're like, the doc's asking you questions, and you're like, well, I don't know, it kind of hurts when it does this. I don't know, maybe you don't really remember, those kinds of things. Well, if you're going to take ownership of your own health, you've got to have the power. And if you're going to have the power, you have to own the information. And that means that you have to be responsible for recognizing what you're experiencing and keeping records of it in such a way that you can actually give a useful history.
That is such a powerful point, Karen. Because I was giving this talk last week. I was saying, people make changes. We want to help them understand their mind-body connection. Oh, as I'm eating better, I am sleeping more. I'm doing this. It's not always natural or obvious to us because our brain will tend to focus on what's not working versus what's
Right.
working. Right, that negative
Yeah.
bias.
Yep.
All right, it's just
Always.
kind of how our brain is designed. Think about this in the audience. When you enter a room, you don't think about the room temperature, so it's too hard to cold,
Right.
right? It's a room,
Yeah.
right? So same thing. We tend to not notice these things unless they're really extreme outliers. And often you bring up like pain logs, right?
Yeah.
Someone comes in for headaches, the first thing we'll say is, "Here's a headache log.
Yeah.
We need more information. Write down when you get it, what happens before, what happens after, because we're trying to see patterns. So it's okay if you
Yes.
don't notice your pattern, but depending on your condition, right? What makes it better? What makes it worse?
Yeah.
When did this generally start? If they're kind of pain episodes, how long do they last?
Yeah.
Any other conditions you have, right? So it might depend on condition, but you're right. What is your experience here? If I can add one more thing to this,
Yeah.
working in pediatrics, you mentioned family medicine, you also saw
Yeah.
kids too. We might know all lab results, but to me, I'm like, only mom and dad knows what that's their baseline. I don't know what this 3-year-old, when he's healthy or not, because
Right.
parents can tell, or dog owners can tell them a slight difference happens. So
Yes.
we should empower people who are above 18 now that same thing from self. They
Yes.
understand if they're feeling a little better or not, and that is a data point. You mentioned labs
Yeah.
that we don't put enough in traditional medicine. The data point of how am I feeling as a patient? What is my energy level?
Yes.
Am I happy? Am I sadder? These things that are qualitative, but we're not putting into the equation. And they're
Right.
such an important part of the equation.
Yeah, very much so. It's interesting because you mentioned the dog, and this was so true with parents of kids. I was always taught, and I always honored the fact that if a mom said something's wrong with the kid, something's wrong with the kid. It
I don't know
doesn't
what it is,
matter
but
if the
something's up.
labs, that something's wrong with the
Always.
kid. And it was interesting because that one of my best friends actually is a golden retriever owner, her fourth one, and she just had this inkling a couple weeks ago that something's wrong. He's eating, he's drinking, he's pooping, he's walking, but there's not, something's wrong. And she couldn't describe it. But luckily, she had a provider who had known her for a very long time who trusted her. And they said, all right, well, let's do some digging. And they did an exam and did some imaging. And 2 days later, the dog ended up having abdominal surgery and had metastatic cancer through everything. And the dog had to be put to sleep. But there was no quantifiable external signs, but it was her instinct
Yeah.
because she was connected to them. And sometimes that's true for ourselves. We can just have a sense, I can't put my finger on it, but something is wrong. Something is off. I am not myself. And
Yeah.
to own that and to stand your ground when the doc's like, yeah, but the labs are all okay. So come back when you're feeling worse and we'll see if the labs show anything. Okay, you're seeing the wrong provider if that's what's happening.
Yeah.
But I think a
Yeah.
coach can really help people have the courage and the ownership to find that voice and to be able to stand that ground. And sometimes that can make a life or death difference.
Yes.
If not at least just an experiential difference. So,
Yeah. And you
so
mentioned
I
like
think,
find the right provider there, Karen. I
yeah,
say it's about your connection with them. If I think the right provider will say, huh, yeah, so far the labs look normal, and guess what? We can't test everything, right?
right,
So we're just figuring a lot of things out. First of all, I had a attending who had a great phrase about functional abdominal pain actually. So for
mm,
functional abdominal pain is what we call when you have pain, but we can't figure out why. Usually we
why?
see in pediatrics, it's kids who have more pain during the school days, for example. But the way he described it was so great. He said, listen, we've done all the exams, and it appears that your function is normal, your motility, your enzyme, etc. But
Right,
despite this normal appearing function, you're still having pain.
right,
And I was like, yes, right. And saying that because of this movie, sometimes if you have an autoimmune condition, it's not going to present in 3 days. It's going to be
right,
6 months. And a lot of patients feeling disempowered, well, but, oh, they got it wrong, and they never followed up. So having a provider who says, yeah, listen, this so far hasn't shown what is going on. Well, how should we
right.
approach this? Do I
Spartans.
follow up in a week, in 2 weeks? Do I send you someone else to do a different
Right.
kind of analysis investigation? But having that conversation, it's okay if I don't know or we don't know, but how do we still move forward together in a
Right,
partnership way?
right. Yeah, and I think with that, ideally coming from the physician as well, but there are other providers, maybe the physical has all appealed, okay. But have we explored, where are things mentally, where are things emotionally, where are things spiritually? I mean, I've
Yeah,
seen people have amazing physical symptoms when they're having a spiritual crisis,
yeah,
and really bring all those aspects back in. And that means that somebody needs to validate the individual's experience in all of those areas and recognize that they're connected. I remember my very first Qigong teacher who said, Karen, your mind isn't up here, your mind is here. It's in every cell of your body. It's in your organs. It's everything. Your mind is not just your brain. Your mind
yeah,
is in
yeah.
your whole body, and to really make that reconnection. And I think that, and I'm not challenging in the sense that I have dear friends who are still practicing as physicians, and it's a hard system. There's a
Hmm.
lot of pressures. There's financial. There's legal. People are like, well, I don't mean to be, negative Nelly, but I have to warn people about this, that, and the other, because if I don't, then I'm legally liable. And I mean, so it's not an easy thing to be a practitioner these days either. And I think that health coaches can do things that not only empower the clients, but help make the interaction between clients and physicians easier,
Yeah,
you know,
yeah,
which I
yeah.
think is important. Yeah.
So, okay, so I think we talked about the three things there. If I'm summarizing correctly, first was get a coach, right? Number one. Two was organize your health data in different ways. And what was that third? The third. How do you summarize the third point we just made?
To know yourself, to chart your own experience, and to be really able to speak about what your experience is with your I language, in such a way. And
Yeah.
I would add a couple of other things. I would just say that if you're going to see a new practitioner of any kind as a consumer, do your research. Don't necessarily see the first most convenient orthopedic surgeon or whatever is there. It doesn't matter what it is. It doesn't matter if you're seeing a new chiropractor or you're seeing a new internist. Do your research and have clear expectations so that you know what's going in. For
Mm.
example, I had a dear friend that was going through a cancer experience, and she met the surgeon that was recommended to her. And the surgeon had no bedside manner, okay, none whatsoever. However, He was the best in his field for the very specific, unusual surgery that had to be done. And so she made a very intentional decision of, I'm going to keep this kind of jerk because he's a really great technician, and that's all I want from him. And I'm going to use my other providers to get what I need from a bedside manner standpoint. And
Mm,
that worked because she aligned her expectations with what that provider was able to do and willing to do. But you having mismatch in your expectations and then being frustrated, going to see the surgeon and not feeling seen or heard, but continuing to go back to the same surgeon because you're trying to get something from the surgeon that that surgeon's not going to give you.
mm.
That doesn't support healing.
Like my sister says, don't ask an apple from a pear tree.
Exactly, exactly. And it's not a judgment thing. It doesn't have to be a bad thing. You don't have to feel guilty that you decided not to go back to somebody,
Yeah.
but really align, those expectations with your needs and with reality. And so that's the same thing with each clinical visit. Know what you want from that clinical visit. So you mentioned that, right? What if we have a successful visit, what will you walk away from, you know, having have happen today? So go in, write your questions down, like you said, that post-it note, go in with your questions written down. And for anything serious, and I've even done this as a patient as a physician, when I'm a patient, take somebody with you that you trust, that can take notes, that can help make sure your questions get answered. And it may not be your spouse. It may not be somebody that's as emotionally embroiled in the situation as you are. One good friend of mine used kind of an acquaintance of hers who had had the same clinical situation, but they weren't really close, but she knew that that person had been through this experience. So she asked her
Mm.
to go with her and she took notes. When I went through a really serious medical situation, I asked a neighbor who I knew was really anal retentive. She took really good notes and she was very vocal. And I said, these are the questions I need to get answered. And admittedly, I got in there and I was very emotionally overwhelmed. And she got every question answered and she wrote it down and she recorded it on her phone for me. So, don't expect you to be able to do everything for yourself when you're dealing with a serious health issue, but ask for help and be an advocate, for yourself. So,
Yeah.
I think, and the coach is not, most coaches are not going to go with you to a medical appointment. A coach can help prepare you for that medical appointment and can help you
Hmm.
integrate the information and the
Hmm.
decisions afterwards. But most people need somebody else in their life, in their world, that will play that role.
Yeah.
So I just think often we don't ask for help very often in our society, and I think that's a mistake.
That's something that even for me personally hitting nerve there, where like as healthcare workers, we tend to not ask for help. And I really appreciate your perspective there. People think because we're healthcare worker, we're immune from this. And I remember in my friends in residency in pediatrics or my attendings would say, listen, when your kid's a fever, you don't know what's going on. You like you are useless. Like what's a fever? 100 what? Like and then they go, you need your friend to do it for you because you cannot take
Yep.
care of your kids as much as you think you do. When it's your kid yourself, all that goes out the window because you lose that perspective, right? So
Yes.
even to your point, your coach can help you through setting some goals. Who's going to be that person for you
Yeah.
that can go be your advocate, your side companion? And I did that. I had a friend of mine, a dear friend, when I lived in North Carolina. She was going to have surgery,
Yeah.
and so I was like, of course, I would take you to back in there and and help out. Like I was really honored to do so. And what amazed me from that experience, I mean, a lot of things, but I remember she came out of the surgical unit, right? She's still eyes glazed over,
Right.
high as a kite from all the pain medication. Like she was laughing gaily. The surgeon came in and gave her all the instructions about here's the medication, I take it out, and she's like, and I'm like, yeah, I got it because I've given these. I understand it, but she is so high out of her mind. There's no way she's getting that, and she
Oh,
weren't. She's just literally waking up from anesthesia. And that day, when that night she had all these pain issues, I was
yeah.
there to help out, right? And literally with her at her place, her and her partner. So it's not about not being educated or not being self-sufficient, not being this like I got it all. It's a setting. No matter how much you practice, it is a different setting. Being there, and you've been waiting. It's so all my medical students like, listen, it's another patient. They've been waiting for 3 weeks for this one visit. Like, there's so much on the line for us
Right.
that
Yes.
even we're there, we could, it's freeze, forget something, whatever it is. And even just having that companion there, that social support, community support, but taking that burden off of you having to do it all there. And so you can just be. that self would help lower that anxiety and make it more effective.
Yeah, especially with the things the way are that they may not have been waiting for 3 weeks for that appointment. They may have been waiting for 5 months. That
Yeah, I was being, yeah, even then I was
yeah,
being
access is becoming more and more and more problematic, and I'm stunned at what I've had friends and family members going through some things recently, and it's like, okay, this needs to be done. Well, the first time that somebody can see you is November. And I live in, metropolitan Minneapolis in one of the best healthcare situations in the country. But that is the tendency, the trend. So I think the pressure of getting what you need when you finally get in there is even getting more and more than it used to be. So I think that's really important. So, set the intention, have your goals for care, but to make yourself successful, know yourself, write things down, ask for help, have support, have a coach so that you've got somebody to work with you before and afterwards. I think it's going to be more and more and more important than it ever was before, and it was already important.
Karen, this is a great roadmap. I'm gonna try to do my summary skills. So now we went from 3 to 6 things. So let me know if I
Yeah.
got this right,
Okay.
right? So, and so many people in the chat are already putting them down there. So I'm gonna help out here. So one was get a coach.
Yep.
2 is organizing your health data, understanding where things are. 3, that really important one, knowing yourself. You are part of your health data. How you feel is part of that, right?
Yes.
4th was that understanding expectations or choosing the best provider for you, knowing who's going to be part of your care team. And if you don't have that therapeutic alliance, finding someone who you will find that partner for you.
Yep.
Number 5 is then knowing what you want from the visit, having your questions written out. What are the goals? What are you trying to learn from this? Or what's the next steps you want the provider to help you with?
Yep.
And 6 was take that someone with you, that's someone that you can trust, can be that support for you to help do 1 through 5
Exactly.
during this session. Did I miss anything from that, Karen?
That was a beautiful summation, lawyer.
That's what the coaching skills that came in.
That's
Okay,
right.
so Karen, I say it's been really. We have a few minutes left as we wrap up here. I want some time to talk about some of what you're doing now. But anything else, kind of high level, to add to the conversation, or anything else before we kind of conclude this wonderful discussion?
And I think for people just to remember that, our bodies know how to heal. And that most of good health care is actually supporting our body to do what it needs to do naturally. And I think that it's lost in the shuffle. A lot of times it's just removing the barriers to healing that has to happen. And so I think the more that we can have hope if we trust ourselves and trust our bodies and know that we have the potential for healing through the challenges that happen in life. So I currently I have done, like I said, 20 years of curriculum development, teaching, mentoring, etc. I have just recently decided that I really want to go back to being able to do some one-on-one work with individual clients and really seeing that difference. So just this month, I have reopened my practice. So I do work with individuals virtually one-on-one. So they don't have to be actually not only not in Minnesota, they don't have to be in the country. I actually have some international connections, so we work across time zones. I'm happy to work with any individual that truly wants to make any meaningful change in beliefs or behaviors as it impacts their health and their health care. However, I in particular really like to work with people who are dealing with, chronic illnesses, new acute serious challenges, those major times of upheaval, because I think that those people need extra support. So I'm happy to work with people. And I will throw out there that I am running a little relaunch introductory special for anybody that does an informational call with me. I do free 15-minute informational calls before somebody commits. And anybody that does a free informational call with me before August 8th, there is a discount pricing available for people's first line of services. So that's what I'm doing these days.
Amazing. To have someone like you start in the field, help someone out. I mean, what a tremendous resource for everyone. And I gotta say, I'm really and Karen, I was gonna say, where can people find you or find your information?
So my website is IHWC Productions.com, and it's Integrative Health and Wellness Coaching. That's what the IHWC is. So Integrative Health and Wellness Coaching, IHWC Productions.com. All the information is on there. That's the best way to get in touch with me. I'm also on LinkedIn and on Facebook, but more often on LinkedIn. And also happy just to make professional connections, collaborations. I have a lot of alumni out there from 3 different programs, and I like to stay connected to the coaches and know what they're doing. So please feel free to reach out to me.
Karen, as something you said about the body healing itself, remind me of it. I'll end with this little quote. When I remember being in first year, the person who was on nights, which she would leave my co-resident would leave little notes on the top of the sign-out sheet. So for everyone here in the night team, when they get new patients, they redistribute them for the morning team, right?
Right.
So you have these patients, right? And she also put little quotes in there. And one that always stuck with me, it said, I'm probably going to butcher it now, but the art of medicine is entertaining the patient while nature cures the disease.
Ooh, yes, that's a good one. Yes.
Yeah, great. It's okay. And so honored having a podcast today. And I'll say, really honored too that you have your website, but I know you're also on Viably as well, so people can find that profile there too.
Yes.
And
Thank
Viably is
you.
to support any kind of solar provider, team, organization. Anyone listening who's trying to get started, even your dog can join there. We're offering, if you type in Salinas 20, it's my last name, Salinas 20. You can get 20% discount for the next 3 months of service, help you get started on helping and serving others. So Karen, absolute privilege and honor having you on the podcast. Thank you for what you've done for the industry, profession, and excited to be collaborating now, pushing that needle forward.
Thanks so much, Diego. You have a great rest of your day.
Thank you, everyone. Take care. Bye-bye.